and I'm not a pilot, so I'm going to be saying some things that, I don't know exactly about, but in general, there's a lot of automated processes in an airplane.
Yeah.
I think for landing and takeoff, I don't think it's completely automated. Maybe it is. I'm not sure about that.
Mm-hmm.
But there is always a pilot there for a reason. Because when things go bad, you want that pilot there to fly that airplane, and he or she knows how to fly that airplane. It's the same thing with a physician that is taking care of a patient. Sure, there are these algorithms, black and white, supposedly, check this box, go here, go there. But ultimately, you want somebody with knowledge of you as a person that can make critical decisions about your life. That's why you have a physician.
That's correct. And so the example I give, I'm not anti-protocol actually at all. I think that protocols serve a purpose up to a point. But they like you said, they fail when you don't let the pilot physician take over control, right? When you don't allow that. And so for the longest time, children are always admitted every winter with something we call bronchiolitis, where they get an infection that gets down deeper in their lungs, and they're little children, little babies with small airways. And, we've tried over the course of my career, I've seen many medications try and fail. And, but more recently they came out with a protocol. This was prior to COVID, about how to treat babies with bronchiolitis. And most of them actually don't respond to albuterol breathing treatments. Most of them don't. But there's a subgroup that clearly do. And those of us who are experienced know that. If I were to follow strictly the protocol for every little baby that comes in and not give them albuterol, then I would have kids a lot sicker than if I make the decision with this one, I'm going to try albuterol, and with this one, I'm going to try albuterol, because they have, and usually what I go by is they have a family history of asthma. So that baby, even though they're only 4 months old, may very well have asthma that has just never been diagnosed because of their age, their young age. So I've kept plenty of babies out of the intensive care unit that were about to go down to the ICU because they couldn't breathe. And I've had our staff give them albuterol, and it turns them around. And so, but to prevent physicians from doing that, as that protocol rolled out, they began to prevent some of us from doing that. Oh, you can't do that, they said. And I said, like, heck, I can't. Why wouldn't I? I've done it my whole career. It's possibly going to help this child, and there's no harm. So it's dangerous when we don't let physicians have control of the wheel when they need to control that admission, that healthcare, because every person's an individual, right? And so I fully agree with you. And we don't want to be raising fearful physicians, training fearful physicians who are afraid to deviate from whatever protocol because they might lose their job. Then who is running your healthcare? Is it the physician, or is it the non-physician administrator that's telling you what to do? Is it the non-physician person sitting in some regulatory agency who came up with this protocol and who hasn't taken care of a patient of that age? Right? This is not what we want to see to that extent. Yeah.
Well, and I think over the last couple of decades, one thing I've seen, and I've talked to my physician friends many times about this, and I appreciate you standing up and speaking out, is that physicians need to take back healthcare. When I first got out of pharmacy school 30 years ago, physicians were in charge. Yeah. I mean, they were. I mean, when you looked at a major healthcare organization or a major hospital or even a small hospital, physicians basically, they called the shots, not the administrator. They told the administrator what they wanted. If they were a surgeon or whatever, they told the administrator what they wanted, and usually they got it. Yeah. And now it's totally opposite, and it shouldn't be. I mean, administrators should not be telling physicians what to do. Now, I think part of it is that just what we were talking about early on in this podcast is that the schools are not admitting physicians or admitting students that are critical thinkers, and they don't let them be critical thinkers. So they are primed to be controlled when they get out of medical school. 30 years ago, it wasn't that way. Physicians were very independent and using independent practice. And they weren't going to be told what to do. And for good thing. I mean, you guys are the most highly educated people in the nation. You guys should control healthcare. Who else should? I mean, seriously. So you guys need to really take it back.
Yeah, I don't disagree. We sold our souls when we became employees. We
Yep.
became employees of these healthcare institutions who then increasingly began to tell us what to do. And coming back to the students again, we do have a lot of students who are still in their training. They still are critical thinkers, but they're not allowed to critically think because the system silences them and it pushes them into this cage of not being able to say certain things. I've had students come up to me and say, "What are we supposed to do? We can't speak. We have no freedom of speech." I mean, they're missing it too. We need to really open this back up again to the way it was when I trained. My professors would say all sorts of things, and sometimes I agreed, and sometimes I didn't when it came to ethical, or viewpoints or perspectives. But that's how you decide what your own perspective is.